Hey everyone, welcome to Whiteboard Wednesday at Sarasota Vascular Specialists. I'm Michael Lepore, and I'm going to talk to you about one of the things that has bothered me since I ever first got into this field, and that is what a vascular surgeon is, because we don't do a particularly good job as a society across the country of explaining to people what that is. So when somebody asks me what I do, and I say I'm a vascular surgeon, they say, oh, you take care of my heart. That is not what we actually do. And one of the reasons we're not that well known is we only finish about 110 vascular surgeons a year across the country, probably one of the smallest specialists from a graduation standpoint across the country, and also a very difficult thing to get signed up into and to compete for with regards to a position in vascular surgery. The heart is important in what we do because many of our patients, if not all of our patients, have cardiac problems or coronary disease. So we have a pretty close relationship with the cardiologists as well. The cardiologists take care of the heart, and the cardiac surgeons operate on the heart. We operate basically on every other blood vessel in the body, from the left subclavian artery, which is right over here, aneurysms that come all the way down through the chest into the abdomen, any blockages in those arteries, all the arteries in the neck that go up, the carotid arteries and carotid artery stenosis for strokes, everything in the legs in terms of blockages that we clear out with balloons and stents is the topic of another day. We also perform dialysis access for dialysis patients, circuits in the arm to try to allow dialysis access. And the cosmetic side of our practice deals with spider veins and varicose veins. Again, topic of another day. There's basically two pathways for training. One is you go through medical school, which is typically 4 years, and then general surgery residency, which is typically 5 years, and then maybe some research for a year or two, and then 2 years of vascular surgery training, which is a fellowship. The other way is what's called a hybrid training program, and there's different types. There's a 3-3 or a 5-2, and these are combined programs where the people trained are doing a portion of general surgery to train themselves in and learn the disease processes, and then they spend the other time doing mostly vascular surgery. Well, why you need one is because we have the unique capabilities that some of our other colleagues in other areas don't have. We are trained in both open vascular as well as endovascular treatment, meaning percutaneous puncturing an artery and doing all the treatment from inside the artery, that's endovascular minimally invasive treatment, or open surgery, which would be a bypass or open carotid endarterectomy, open aneurysm repair, and certainly vein treatment. Some other people may be only interventionalists, like an interventional cardiology or an interventional radiologist, and they can do just percutaneous-based or catheter-based options. A vascular surgeon who's endovascular hybrid trained is we can offer the best of both, and we do them all very well, which means that not every artery should be treated by a balloon and a stent, and not every artery should be treated by bypass, but you want to go to somebody that has the ability to treat both and treat both well with experience. And that is why you want to come to a board-certified, fully hybrid-trained vascular surgeon. So in summary, vascular surgeons, I already said, that's me, and that's the rest of my partners, and we train for some time. I gave you the years in terms of that. It can be anywhere between with medical school and all the training, 11 years, sometimes longer based on your research background. And we take care of all the blood vessels in the body except the heart. Most importantly, you really want to have somebody, whether it's somebody in Sarasota Vascular Specialists or anywhere in the country, you want somebody who's hybrid trained that can offer you the best of both. Welcome again to Whiteboard Wednesdays, and I'll be seeing you at the next topic. Thank you.